Minister of Health Dr. Frank Anthony on Monday said the funding which has been set aside for the country's COVID-19 response covers all areas that need urgent intervention from the government. With millions of dollars pumped into the fight against the novel coronavirus, the PPPC government has assured that every effort will be made to slow the transmission of the pandemic here. President of the Cooperative Republic of Guyana, His Excellency Dr. Mohamed Irfan Ali, last week reported a $4.5 billion injection into the fight. The head of state also announced the mobilization of US $60 million from the World Bank, the OPEC Fund for International Development, the Inter-American Development Bank, and the Islamic Development Bank. This is also in addition to another US $2 million grant from the government of India. Speaking with InfoHub on Monday, Minister of Health, the Honorable Dr. Frank Anthony, shared how the funds will be utilized.
From that money, what we expect to utilize some of it to help to bring the at least a part of the Ocean View Hospital from the ministry in the Georgetown Hospital that is working to ensure that we can put at least 55 beds in there as an isolation facility. So the procurement of those items, we are currently utilizing some of the resources from that. We talk about getting an automated PCR machine. And so some of that funds, some of it we are utilizing right now to buy one of those machines. As you might know that these machines, they're like hotcakes, fire them. And so we have to be very quick in terms of putting in our order, getting the money out to them so that we can get this machine in a timely way. So that's some of the ways of how it has been utilized.
Dr. Anthony said the government is directing its efforts towards a socio-economic response, providing assistance to vulnerable populations and small businesses. Since taking office, the health minister has met with several donor agencies, international representatives, and local business owners to effectively tailor the COVID-19 response to being all-inclusive.
We have had very fruitful meetings with a number of agencies, a number of organizations. So, for example, with the UN family, we have met all of the organizations in the UN family, but we have been dealing in a more focused way with PAHO WHO. PAHO has been able to coordinate a number of the actions that we want to take with resources from their head office in Washington. So, for example, when we needed training for lab technicians, they were able to bring those technical resources to bear. There are other things that we do. We do modeling projection of disease, how the spread would be, and they have epidemiologists that are working with us to be able to do those projections. So they bring in a lot of technical experts, also been serving as a kind of procurement hub for us. So we have identified a number of the things that we require, whether it's in terms of equipment, PPEs, or other things that we need to help us to better respond to the pandemic. And they have been able to acquire these things very rapidly.
While the country battles with the virus, the health minister reported the increased training for frontline workers. Dr. Anthony revealed that some 29 ventilators will soon be arriving in the country, with some destined for regional hospitals. These facilities will now have intensive care units, specifically for the treatment of severely ill persons who tested positive for COVID-19. With this service coming on stream, competent staff will be needed to operate the machines.
If we put the ventilators there, we want to ensure that the doctors are through the Georgetown Hospital to do training for the doctors who will be working in the ICU areas. And that training is for them to understand how to do proper ventilation, when to put patients on this ventilation, and how to use that piece of equipment. Because we intend that no hospital, but we need to build that capacity in our regional hospitals. As I've told you before, we're expecting to have 29 ventilators coming in this week. And once we get those ventilators, when we deploy them to regional hospitals and so, we want to ensure that we have people there who understand how to operate these ventilators. So that's another form of training. Doctors in terms of treatment protocol.
The minister noted the importance of training for support staff to the ICUs, including nurses and other key healthcare personnel. He said community health workers are also being trained in infectious diseases prevention and control.
These are going to be continuous and ongoing training were adopted from the WHO because they have several modules that are online and we have adapted them to suit our context. So that's going to be an ongoing training and we are hoping that sector to understand these protocols and so forth.
The training models being utilized to improve Guyana's response to COVID-19 at the healthcare level was designed and approved by the World Health Organization. However, the Ministry of Health has extracted key components of the training, adopting it to fit the Guyana context, which will render it more relatable and effective. The training programs are available online.